Welcome to Centered Support Services Infection Control Training. In this video, we'll cover essential practices that help prevent the spread of infections and protect both you and your clients. Hand hygiene is the single most important measure in preventing the spread of infections. But when exactly should you wash your hands? Always wash your hands before and after providing personal care or handling food. This includes before preparing meals, after using the bathroom, after handling soiled items, before and after wound care, after removing gloves, when arriving at and leaving a client's home. Remember, washing with soap and water for at least 20 seconds is the gold standard. Simply waiting until your hands look dirty or just washing at the end of your shift is not sufficient. Personal protective equipment, or PPE, creates essential barriers that prevent the transmission of pathogens between you and your client. When handling bodily fluids, you need appropriate protection. Gloves and a mask are necessary when assisting with toileting, cleaning up bodily fluids, providing wound care, working with a client who has respiratory symptoms. Cross-contamination occurs when pathogens are transferred from one surface or person to another. The most effective way to prevent this is to change your gloves between different caregiving tasks. For example, if you've just helped a client with toileting, remove those gloves properly, wash your hands, and put on fresh gloves before preparing their meal. Using the same gloves for everything might save time, but it spreads germs and puts your client at risk. Minimizing the spread of germs in a client's home requires regular cleaning and disinfection of frequently touched surfaces, such as doorknobs, light switches, remote controls, phones, bathroom fixtures, kitchen counters. It's not enough to clean only the client's bedroom or bathroom once a week. Regular disinfection of high-touch areas helps prevent pathogen transmission throughout the home. When handling soiled bedding or clothing, your first step should always be to use gloves and discard the items in the correct container. Never handle contaminated materials with bare hands, even if it seems faster. And never leave soiled items for later, as this allows pathogens to spread. Remember to place soiled linens in designated containers and follow your agency's protocol for laundering these items. If you're accidentally exposed to a client's bodily fluids or a blood-borne pathogen, immediate action is crucial. The correct procedure is to clean the exposed area immediately, report the exposure to your supervisor, document the incident, follow Centered Support Services protocol for further action, which may include medical evaluation. Waiting until the end of your shift or until symptoms develop puts your health at risk. And never ask the client to help you clean up after an exposure. While hand washing is preferred, alcohol-based hand sanitizer is necessary when there is no access to soap and water. Apply enough sanitizer to cover all surfaces of your hands and rub until dry. Remember that sanitizer is not effective when hands are visibly soiled. What should you do if you notice a colleague not following infection control protocols, such as not wearing gloves when they should? The best approach is to politely remind them of the correct procedures. We all have a responsibility to maintain a safe environment for our clients, and sometimes a friendly reminder is all that's needed. Proper infection control is essential to providing safe, quality care. By following these protocols consistently, you protect your clients, yourself, and your community. Remember, wash your hands before and after providing care. Use appropriate PPE for tasks involving bodily fluids. Change gloves between different tasks. Clean and disinfect frequently touched surfaces regularly. Report exposures immediately. Use hand sanitizer when soap and water aren't available. Thank you for completing this infection control training with Centered Support Service. If you have any questions, please speak with your supervisor.